For more on the coronavirus and the latest on where we are, I want to bring in Dr. Scott Gottlieb, former FDA commissioner and CNBC contributor, who's been helping us virtually every morning these past couple of weeks understand where we are. How important is this new testing capacity for us, Doctor?
Extremely important. This is an automated system, so this is going to substantially increase the throughput in the labs. There's other systems like this, the Hologic system. There's self-contained systems by companies like Cepheid. I think you're going to see a rapid sort of succession of approvals of these systems. And by probably next week, we'll be at capacity of tens of thousands of tests a day. Certainly by the end of next week, I think you're going to see capacity really sharply ramp up in our ability to test patients. What will also ramp up is the number of patients that we're finding that are infected with this virus.
Well, so that was what I was going to ask, is we're going to find, we're going to see a spike in the numbers, I imagine. Is it going to change how we're approaching this, which is to say that at least thus far, once we've identified that somebody has it, they're quarantined, and then we go and we look to see who else around them can ultimately be quarantined or self-quarantined for some period of time. One of the things that was said in the UK yesterday, for example, is that they were effectively going to stop that approach to this because they thought that it had already gone too far already.
That's right. Once you really have a large outbreak and someone presents with symptoms, you just assume that they have it, and you tell them to self-quarantine so they don't continue to transmit it. So it becomes less and less important to test every individual who might be symptomatic. But there's still a role for that. When you have expanded capacity, you could test more people. You could turn over more cards, especially in places where you don't have an obvious outbreak. You can identify it earlier. So this is definitely going to be a welcome development, the ability to test far more people than we could do right now.
What do you know about potential treatments? There's, if you spend time online and among investors, they are now reaching out to doctors all across the world to try to see what's going on. There is talk about this cocktail mixed with malaria mixed with zinc that seems to be having some success in South Korea.
Yeah, well, I'm not sure about that, chloroquine, but there's going to need to be a technological solution here, because this is going to be something that becomes epidemic over the next 8 weeks to 10 weeks, but we're still going to have outbreaks going into the fall, and the question is, what do we do then? So what you need in the fall is you need a point-of-care diagnostic in the doctor's office so doctors can identify outbreaks very early, and hopefully we'll have some kind of therapeutic. The two that are the most promising right now are some of the antiviral drugs that are being repurposed for this. One is called remdesivir by Gilead.
Right.
The other approach is the antibody-based prophylaxis. So this is a drug that you can basically give on a monthly basis. It's an antibody to basically protect people from getting the virus. Right. And you would use that on your frontline healthcare workers and people who are vulnerable to this. And Regeneron's far ahead on trying to develop that kind of a product. There are a couple other companies in the mix, but there's a three-pronged strategy here. It repurposed antivirals, the antibody-based prophylaxis, and then hopefully a vaccine, which is probably...
Do you think that we're going to be able to bend the curve here? And the reason I ask is we look at Italy, and obviously everybody's trying to avoid Italy, given all the steps that have been taken even the past 48 hours. Do you think that's going to change the outcome?
I think we already are bending the curve, frankly, given everything that the private sector is doing to engage in social distancing. Now, how much is unclear. We're still going to have an epidemic here. We need to continue these very forceful measures to make sure that epidemic isn't as large as it could be.
I mean, people are doing it themselves, too, in schools and all the things, all the closings you were wondering about. It sort of happened in one fell swoop yesterday. Scott, I'm wondering, I'm not sure whether it's good or bad when some health officials give a sort of an estimate. Did you see the Ohio health official that said there's 100,000 cases in Ohio right now?
Yeah, the calculation seemed a little implausible to me, and I think if you had 100,000 cases concentrated in a state, you'd see more admissions.
So why would a health official say that? And I saw how she did it. She multiplied 1% by the state's population and came up with 100,000 and said there are currently that many cases in Ohio. You think that's okay, or does it help because it at least drives home the point that we're under-reporting what's happening because of no testing? Or is it just totally irresponsible? I read it and said, who let you get this job, almost?
Yeah, it seems a little implausible to me, saying that 1% of the population has it based on a handful of cases that they have. What they probably have are some clusters of outbreak, but it's not pervasive across the whole state. This isn't evenly distributed. So to say 1% of the population has it.
And then the other, some congressman said 150 million Americans are going to get infected, because I guess she was recounting what a health official told Congress, and that was the high end of where it could go if what you warned, if we didn't bend the epidemic curve at all, 70 to 150 million is, I don't know, where do you get that number and why would you share that? Is it helpful to share 150 million for America? I guess it does cause Americans to change their behavior.
Well, look, that's if you let it burn its way through the population without taking any measures whatsoever. And it is going to be the case unless we get a vaccine over time, over a course of years. A lot of people are going to get this. But right now, we can contain this in a way that the epidemic, we can contain the scope of it.
Anecdotally, Scott, in any emergency rooms around the country, are we at when will we know whether we're going to get overwhelmed, our ICU beds, and with vulnerable people that have it? Will we know? Would we see that in the next 2 weeks if that's going to happen? Next 3 weeks?
Yeah, I think we're probably 3 weeks away from starting to see cases show up in the ICUs and hospitals starting to get a little bit pressed there. If you look at some of the data from cities, including New York City, you've seen some spikes in people presenting with influenza-like illness. And actual flu diagnoses are back to baseline. So that could be a suggestion. It's one of two things, a suggestion that coronavirus is circulating. We're starting to pick it up in the data. Or it's more the people who are, have some other respiratory disease and now they're presenting because they're worried about coronavirus. Might be a mix of both right now. And there is a spike in New York as well, although the recent data isn't out. Yep. I don't know what the New York officials are looking at, that they seemed extremely concerned in the press conference yesterday. Now, they should be concerned, so there's enough out there already for them to be extremely concerned. Right. I wonder if they're looking at any data.
Hey, Scott,
we don't know,
the other issue that people ask me all the time and that you're starting to hear in places is, should I go to the doctor's office for normal issues? Should I stay out of doctor's offices? Should I stay out of hospitals if I absolutely don't have to be there?
I would try to avoid interactions with the healthcare system if I can right now. And I think hospitals should also be looking at canceling elective procedures to try to preserve volumes in the hospitals, preserve capacity. We need a systematic approach to that. We're not really having that discussion at a national level. We should be.
Does that include things like dentists, things like, dermatologists?
I'm trying to avoid non-essential health care right now personally, so I'm giving you my personal advice. I would try to avoid interactions with the healthcare system just to help the healthcare system preserve capacity. Also, this spreads when it gets inside institutions and inside the healthcare system. That's how a lot of the virus is propagated in other countries. So, there is a risk in those kinds of settings. Now, I'm sure providers are taking stepped-up precautions, and we do very good infection control in this country, so we're going to have less of those kinds of problems. But there is a risk in an institutionalized setting of spreading this virus.
At this point, Scott, do you see the track of of coronavirus here similar to any of the other countries, either Italy or South Korea or Iran? Or what do you think it looks like here, and do we just not know at this point which way we're headed? I mean, could it be Italy in the United States, or have we already addressed it more effectively than that country?
Yeah, it's tough to say, Joe, because we're vulnerable in ways other countries aren't. We're a very mobile population. We seeded a lot of virus probably in different parts of the country. We're not going to be able to put in place quarantines and lock people down like other nations have done. So, we're late to it. I mean, we're a little bit late in terms of getting a handle on the outbreaks that we have. So it's hard to say. That said, I'm impressed by what the private sector has done and some cities and states have done in acting very aggressively very early.
Hey, Scott, can I just say we appreciate your voice, because I feel like you have been one of the best voices we've had out there, just a voice of absolute playing with facts and the facts only. We appreciate it.
Thanks, Becky.
Yeah.